Well, the health department had predicted before this that people of color and Native American Minnesotans would be more prone to catching this virus because of historic income disparities, which affected in turn their access to health care. And that is proven to be true, and they're closely tracking that now as they try to intervene in some of the hot spots.
This public health crisis is exposing and exacerbating the racial, economic, and educational inequities that have been here all along.
The data is bearing that out. Black Minnesotans being hit disproportionately with COVID infections and hospitalizations. The same for the Latinx population in Minnesota, higher rates of sickness in proportion to their numbers in the state. But their exposure to the virus is also higher.
We also know that Native Americans and people of color, particularly immigrants and refugees, also are often the ones working in industries identified as essential services as businesses, such as manufacturing, the food industry.
The health commissioner said equity will be a goal when they decide which patients will be treated with remdesivir when the state receives its shipment of that drug, which shortens hospital stays. Something else that came up in today's briefing, a $6.9 million budget item in the legislature's COVID-19 fund for, quote, human remains storage.
To buy a building where we can properly handle with dignity and respect and safety the bodies of Minnesotans who may fall victim to the coronavirus.
Joe Kelly, the Homeland Security Director there, says he doesn't want to see the scenes that they had in New York with people being buried in temporary shallow graves. He doesn't want that to happen. That's why they put money in the fund for storage. Now, speaking of that fund, the legislature approved it. It's supposed to sunset on May 11th. There's about $65 million left in that fund, and the governor today asked the legislature to please extend that expiration date and let them have access to this money later than May 11th. Back to you.
All right. Thank you.